Macroplastique is an injectable soft tissue bulking agent called polydimethylsiloxane. It is used for treating stress urinary incontinence in women due to intrinsic sphincter deficiency. Injected macroplastique results in a pretty characteristic histopathological appearance. There is a foreign body giant cell reaction and chronic inflammation, fibrosis, and rather angular, semi-translucent, refractile fragments of macroplastique that in areas will be partially surrounded by foreign body type giant cells. This is a urethral biopsy. On the right side of the picture is a piece of urethra, and as we pan towards the left side there is refractile material, and this is macroplastique. And here is macroplastique under a higher magnification. You can see the rather angular appearance of the fragments of macroplastique that are semi-translucent and partially refractile, and they are surrounded by fibrous tissue with a sprinkling of chronic inflammatory cells. And around some of the fragments are foreign body type giant cells. So it's worth being familiar with the appearance of macroplastique because it does crop up from time to time in urethral or bladder biopsies as an unexpected finding where the clinical history is incomplete or absent.